It's time now for Vuga Health. Well, June is Men's Month in the country, and reproduction or making a baby is a simple and natural experience for most couples. However, for some couples, it is very difficult to conceive. A man's fertility generally relies on the quantity and quality of his sperm. If the number of semen in a man ejaculates during an orgasm is low, it can be difficult and sometimes impossible for him to cause a pregnancy. Well, joining me in studio to discuss this further is urologist Dr. Kali Spencer. A very good morning to you, Doc. Thank you so much for joining us.
Thank you very much.
Can we just first of all start by defining what a low sperm count is?
Sure. So I think it's important to understand that there's sperm and then there's semen. So sperm is the actual cells with inside semen, which is the liquid that's ejaculated out during sexual intercourse. So you can have an absence of the whole liquid substance coming out, or there can be a deficiency in the number of cells, which we say is normally less than 39 million cells per mole.
It's quite a lot of cells.
Yeah, sure is.
On average. So what would you say are some of the medical causes then of a low sperm count?
Sure. So, I mean, there's quite a large variety of causes, and it can range from anything from we don't know to stress, to lifestyle factors such as smoking, drug use, particularly your marijuana, and other illicit drugs. It can be related also to infections. So having mumps as an adult can be a cause. It can also be related to an undescended testicle. So during normal development of the testicle, it starts in the abdomen, and just after birth it moves down into the scrotal sac. And if that doesn't happen and the testicle stays higher up, the changes in temperature can affect sperm quality. And another thing is something called a varicocele, which is a collection of dilated veins which are found inside the scrotum, and that also alters the temperature and can affect the sperm count. And then there's a variety of genetic causes, which are very rare.
All right, and what about the symptoms then of a low sperm count? How does one tell if they have one?
Yeah, so it's quite a hard thing to tell. It's generally asymptomatic. Unless you've had a previous infection, you'd know about that. But generally it's asymptomatic. But generally it's a couple that's been trying to conceive for a year. And if after a year they failed, then we start speaking of infertility. So that's when it becomes, we become aware of it.
So regarding when a person should go see a doctor, if it has been about a year of trying to conceive and nothing's happening, then both the man and the woman should probably go check themselves out.
So it's a combined, it's usually, it has to be done as a couple. It's very hard to say it's this person or it's that one. So, so there's 30% chance of it being the male, 30% chance of it being a female, and 30% chance that it could be either of them or both of them.
What about the other 10%? Who does that fall on?
Well, I mean, that's point...
Just, okay, 0.3333.
Exactly.
Okay. And what kind of tests are used to diagnose low sperm count?
Sure. So, I mean, you would see the doctor. It would be a full consult. You would have to do a history, and the doctor would have to examine you, because there can also be an obstructive cause, so there could be blockages along the way. Previous STIs I didn't mention, TB. We have a high rate of prevalence. We see a lot of TB. TB can block the ducts, so the sperm may not be able to leave. So we can examine, we can do ultrasounds to have a look and see if where the obstruction may be. And then there's a series of blood tests that can be done. But the defining test is the sperm analysis. And that needs to be done in a very particular way. If it's not done correctly, then it can impact the results. So a man needs to consult with the laboratory where he's submitting the sample to make sure he knows how it needs to be done and submitted.
So can a person still have children then if they do have a low sperm count?
So yeah, it depends on the cause. And if there's a treatable cause, then yes. Sometimes it's just persistent, sometimes it's luck. Sometimes when you're not trying so hard and that stress element's removed, sometimes it happens. But other than that, and if there's a hormonal problem, you can replace the hormones. But nowadays we have a whole range of, artificial insemination, your ICSI or your implantation procedures. So there certainly are options available. Some of them quite expensive, but not impossible.
So what are other treatments? I mean, you said that some of the causes are treatable. So what sort of range are we looking at? If it's something environmental, if it's something medical or genetic?
So first, yes, you would start with lifestyle changes. Like we tell our patients with most conditions, stop the smoking, exercise, lose weight. Smoking is big. Stop the illicit drugs. If there's any medication they're on, that may need to be altered. And then if the hormonal tests come, if there's an imbalance, then those hormones may need to be corrected. If there's an obstruction, disobstruct, find where the blockage is, remove it. But the specific fertility procedures, where you can do IVF in the lab, you can, get the sperm, get the egg, fertilize and then implant. Those options are available.
In terms of risk factors, I know that you've mentioned smoking quite a lot. Are there other sort of environmental or lifestyle risk factors that make someone prone to having a low sperm count?
Yeah, so smoking is a big factor. As I said, marijuana can affect the quality of sperm. Some of the other illicit drugs, specific prescription drugs, those would all have to be checked with your doctor. Those are the main lifestyle things. They speak of occupational hazards, working with chemicals and that sort of thing. I don't know if we've got a very conclusive link between chemicals and low sperm counts, specifically, and which ones do it. Some people also speak about cyclists, cyclists who are long-term cyclists doing, big races and that sort of thing could affect sperm quality. And obviously there's the risk of testicular cancer as well. Testicular cancer being another cause of infertility.
So in terms of screenings, at what ages, at what intervals should men be going for screenings just to check perhaps?
Don't really screen for it. It's more the couple that comes in, as I said, that's been trying and just not succeeding. We don't really screen for it.
And would you perhaps recommend counselling for the couple if they have been trying and they now have to go through certain treatments?
Definitely, yeah. They'd have to start in counselling because it's quite a long road and at times it can be frustrating and difficult and expensive, like I said.
And just lastly, to some of our male viewers who are watching at home, if somebody has probably been trying to have a child for more than a year and now having listened to you, they might think that perhaps I might be suffering from this low sperm count. And maybe they're just thinking, I'm a bit embarrassed, what would your last words be to them?
Yeah, and you hit the nail on the head. Men, unfortunately, are afraid to come, or they don't think, it's manly enough to come to, or, think there's something wrong with them, because this is their manhood now, And I think they just need to put that aside and, not to be afraid, see a doctor that you're comfortable with, and there is help available, and the problem can be sorted out.
Well, thank you so much for joining us here on VUCA Africa, VUCA Health segment. That was Dr. Kali Spencer, urologist, talking to us there about a low sperm count.